Mario, welcome. I understand that you have something new to show us on stage for the first time here right at Disrupt.
Exactly. I want to take a couple minutes to give you guys a taste of how Oscar feels and works before we get into the conversation. In short, we're a health insurance company that uses, let me just go back here real quick, that uses data and product design to guide you through your healthcare and get you healthy really over time. And we're launching a new thing now. It's a better data infrastructure that allows us to sort of be more in the loop and in the flow as important moments occur in your healthcare journey. I'll show you this how this works here. So I come into the Oscar mobile application on the screen here, and I would usually come into the app when I want to, on a daily basis, check whether I'm hitting my step counting goal. One of the things we do as an insurance company is we pay you a daily dollar for hitting certain step counting goals. There it is now on the screen. And by the way, that's a beautiful illustration of our business model as an insurance company. Anything we do that gets you healthier, we are able to invest in because our business outcome is nicely correlated with your better health outcome. It's like the overall way we think about this. I come in here, I see the inbox. My concierge team is communicating with me through this inbox here. The concierge team is a very unique way in which we mix member services with clinical services. It's 4 people. Any interaction I have with Oscar will go through those 4 people. One of them is a nurse, and the nurse is now able, in a better way, to monitor essentially my vital signs and everything that we know about you as you navigate the healthcare system. In this case, she recognized that I did a blood glucose test recently. One of the values came out high. She knows I'm on a particular drug already for my diabetes in this case, and she thinks I should go see a regular endocrinologist as part of my navigating the healthcare system. She's able to say, here's a curation of endocrinologists that I think you ought to go and see. That's curated, meaning specifically selected for who I am and what my needs are. And kind of look around here. Dr. Williams is a good choice here. We know a lot about these physicians, and we can match them in a better way to you as a member because we know things like this physician treats diabetes quite a bit in our members and other insurance members. We even know that she sees lots of men my age, which sounds very funny now that I say it out loud. But that's one way we can sort of like mix and match you with the right physician for you. And we know she's seeing other Oscar patients. Just at this point, you can realize already why we chose to be an insurance company. These various data flows that we got to combine to get this picture of you as a member are quite astounding. We have to see lab tests almost in real time. We have to see drugs you're on, and we know that because we pay for these drugs for you. We have to see which other physicians you have seen. We have seen what you have done at those physicians. And we can combine all that to now say, here are endocrinologists for you, and we think you ought to go and see one. And in this particular case, we have a deeper technical integration with Dr. Williams as well that allows us to do direct appointment scheduling. You click a button, you go in. If I couldn't find the slots, I can go back to my concierge team, those 4 people treating me, taking care of me, and they couldn't do that for me. So that sort of like is a nice loop where we touch on a whole bunch of things we do differently than any traditional insurance company and where the technology comes to bear as well.
Yeah, so it looks like it's a really nice overall design and technology, using technology to get really personal with your healthcare. Well, we can't start any healthcare discussion without first talking about what's going on in the Senate right now. Is this bill bad or good for Americans in your opinion?
I think the bill as it stands right now has a lot of flaws and needs to get fixed up, and that's what the Senate has already said. They're now going through looking at what they think the right kind of individual market design should look like. I think that it's extremely important, and I think the Senate gets this, the House gets this, anybody else in Washington gets this, that there be a viable individual market. The individual market that was essentially sort of like put on more stable footing a few years ago with the last health reform is now serving about 20 million people or so if you add everything together. Those 20 million people are getting health insurance coverage oftentimes for the first time in their lives. And yes, there is a viable individual market design in that bill that I think can get built out, but that needs to happen.
It seems like what's going on right now, though, is that a lot of health insurance companies have had to pull out of markets or are threatening to pull out of markets, and also a lot of health insurance companies, yourself included, has had to raise premiums. So how do we fix that?
There's many, many different things wrapped up in that. And I think at the core of the issues you've seen in individual markets is that it's a reflection of the issues we have in the overall healthcare system. The most astounding statistic that I really know in my life, that Warren Buffett talked about recently as well, is that We spend, as in the US, 18% of GDP, gross domestic product, on healthcare. It's about twice as any other rich country in the world, as twice as Japan, Germany, Switzerland, and so on. So we overpay to the tune of about $1 trillion or $1.5 trillion every single year for our healthcare system. Part of what you're seeing now in the individual markets is what you've been seeing in, frankly, all other healthcare markets for the past decade or so, that the costs are just getting out of control. What I think the individual markets to date has not done particularly well, it hasn't started controlling those costs in a better way. That's why you're seeing deductibles go up. You're seeing one of my favorite statistics now in the employer market is that even among employer-sponsored health insurance, it used to be the case that if you go 6-7 years back or so, only about 4 or 5% of members were on deductibles over $1,000. So the first $1,000 of your healthcare in a given year coming out of your own pockets, that's now up to 40%. So the costs are making their way through the system, overwhelming all of us. In the individual market, you sort of like see it first.
You've pulled out of 2 markets already, and according to Bloomberg, it's all over the news, you've lost $200 million last year. Seems like this might be a business model that isn't working.
That goes to the second question, I think, and that's the stability of the particular individual market design you've had for the past 3 years or so. In any new insurance markets that comes out, you have a couple of years of adjustments where the regulators have to come back in and shape exactly how the policies work and whether they work. If you go back about 15, 20 years ago or so, when the Medicare Advantage market came out for the first time, which is essentially private insurance companies managing healthcare for members over 65 years old, it today is the most profitable market in insurance, the most stable market in insurance. But in the 4 or 5 years after the launch, in the early 2000s, actually dwindled membership and then started coming back up again as regulation caught up to the realities of the markets. And so you need that same regulatory fixing, regulatory conversation and policy conversation also in this individual markets. I think that's the main issue of what's going on there. Insurance companies tried to feel their way into these new kind of markets, try to price premiums in the way that they thought it attracts the best mix of sicker people and healthier people, and that process takes some adaptation, including for us.
How do you plan to turn that around? Speaking of you, yeah.
We're founded in 2012. We do 3 things as a company that I think is very different than any other insurance company. Number 1 is we engage members from the very beginning. You saw the app and how it does that. We build everything in-house. We have a full technology stack in-house that does everything from clinical interaction to claims payments to member services, concierge management, and so on. And we build our own custom-made networks of hospitals, doctors, and the technology that powers all of them. So these 3 things. We're very unique in the way we push that. Last year, for example, Oscar members used telemedicine at about 25%, the membership base at the telemedicine visits. You look at other big incumbent insurance companies, maybe 2 or 3% or so are using telemedicine to take care of conditions. If you come to the Oscar office, you'll see on the wall a real-time metric of how our medical costs are doing and how well we are able to manage them now. Okay, that goes to our second point, full stack technology in-house. If you look at the way we manage our physicians, you saw that we have real-time scheduling with many physicians in our membership base. We can push your clinical data back to these physicians. They know who you are when you walk into the door in a better kind of way. Those are very, very unique things. We spent the last 5 years building that stack. In 2017, I feel now for the first time really extremely confident that all these pieces are in place in a way that you will see it flow through to the financial results as well.
You think you'll be profitable in 2017?
I think we will have a much better performance than we had in 2016, and our improvement already relative to the rest of the markets has been generally outpacing the market by quite some time. The way our medical costs have come down from 15 to 16, 16 to 17 is vastly outpacing where the rest of the market is. But it's early in the year. Insurance companies need some time to see the year play out before they can make determinations about medical costs and where they come out.
You said the same thing, relatively the same thing about the technology bringing costs down in 2015, said you'd be profitable in 2016. Obviously that didn't work out. So why are you so positive that you'll be on that path this year?
I think the biggest thing that was, so first of all, maybe answer this, I'm much more comfortable because I'm seeing the data, I'm seeing the engagements, I'm seeing the differences that had made for us to do everything in-house. If you go about a year back or so, we were actually not still controlling our claim system. That was a system that was outside of Oscar that's now fully in-house. We did not have our own network of physicians and hospitals in all the geographies we are in. Now we have that. In New York City now, for example, we have particular hospital partners who we have deep linkages with. We can do much more interesting management of care between us and between them. So that's combining to a much more powerful model right now. But the other reason why I think it's taking longer, and why from the beginning we told investors and everybody who's willing to listen that it will take a while, even now I'm going to tell people the same thing, it will take a while, is that this is a extremely hard industry. We were the first ever technology-driven insurance company out there. We're still to this day really the only health insurer at scale that's doing everything in-house, built all of its own networks and so on. And in particular what's difficult to navigate is how well are the regulatory frameworks working. The government, as an example, owes us $200 million, which in any normal operation of the health reform from a few years ago would have gotten paid out. That was part of the stabilization plan the government in smart ways had put in place to make sure insurers get eased into this new regulatory regime. And when those things start going sideways, it just takes longer to make sure we're on the right track.
So the government owes you about the same as the amount you lost last year. Is there any correlation there?
Yeah, there is a correlation, because the program that the government designed, in essence, to sort of like backstop insurers' operations in the first couple of years was put in place specifically because it was impossible to know what the price and things like that. To give you a great example, as this is, to me, the most beautiful illustration of how different it is to operate a startup in a world like healthcare and health insurance, okay? If you are, a startup like many of you I'm sure are, you want to go into new markets, you think about your pricing as sort of like a door opener, if you will, early on. You want to come into a market and say, I'm going to build a membership base by pricing a bit low maybe early on and taking the price up to my real costs as I go along. In insurance, it's completely impossible to do it that way. We right now are filing premium rates for 2018, okay, almost near advance. We have to file rates that we have to stick to for the entire year of 2018 with very limited knowledge as to how our membership and risk has developed even this year, without even having fully closed the books on 2016, because various government programs still take away finance from Oscar, give finance to Oscar as sort of like the year plays out and certain risk scores come in and stuff like that.
Yeah, and since you said the government owes you $200 million, and for those who don't know, Josh Kushner co-founded Oscar. He's the brother of Jared Kushner, who is very influential in the White House right now. But you can imagine the headlines. The government owes you $200 million. If they were to pay back that $200 million right now, that seems like that would be a really difficult position for Oscar to be in. You can see the headlines saying, government bails out Kushner family with ties to Trump.
There was a specific regulatory framework that's not this government put in place, the previous government put in place, that I think had some very intelligently designed interlocking parts to make sure the right sort of like mix of healthy and sick members comes into these new markets. The insurers price at the right level that, again, get more members to come into the markets. The insurers have time to figure out where the risk of the market is to make sure to adapt pricing, to get hospitals, doctors time to adapt to this new regulatory regime. Parts of that didn't work as intended. What we're talking about here is only to make sure that whatever framework comes next is so smartly designed that now the market gets stable and 20 million people continue to have health insurance. There's nothing else beyond that. There's not a conversation between the administration and insurance companies, the conversation between the regulatory bodies and the insurance companies.
Do you feel like we have a moral obligation? It's not just a business obligation, but a moral obligation to cover all 20 million of these people who might be missing health insurance?
I think so. I think that as the best country on earth, and I can say that with my deeply German accent, makes it sound even better. I think we have an obligation to make sure that people are covered against catastrophic healthcare costs. I think a third of all personal bankruptcies until 2014 or so were related to health insurance. The uninsured rates got shaved off by a couple of percentage points as we came in. The health reform was an important step towards a better functioning healthcare market. I will also say that a lot more needs to happen to make sure health care as an overall market, not just health insurance, health care gets fixed and becomes a stable functioning market. Again, if you go back to the 1970s and you look at how real wage growth has played out in this country against productivity of businesses, usually those two things track very nicely. As productivity in the country goes up and the economy goes up, real wages grow alongside that. That relationship broke down since the 1970s until today. And almost all of that is because benefits, increased benefits, in particular increased healthcare costs, have sucked up so much of the cost that we otherwise would flow through, of the revenue flow for the wages otherwise. Warren Buffett said just last weekend that the particular issue making American business uncompetitive isn't so much taxation, it's the rising cost of healthcare vis-a-vis any other rich economy in the world. We've got to fix that part, but we have to make sure that while we do that, we give coverage to people who are in need, and that we all are solidaric in making sure we cover each other.
But how do we cover all these people for raising premiums and we're pulling out of certain markets? How do we cover these people?
I think that goes into the discussion on how do you design a stable regulatory framework. Any kind of like stable health insurance market needs a combination of some participation, encouragement / requirements, and some support on the premium sides. And so the support on the premium sides in the past has been subsidization. It may be in the new version of the bill being discussed, tax credits. That sort of like can be made to work. On the participation sides, you have a mandate right now, individual mandate with a penalty, and the idea is to replace this with continuous coverage requirements. So a requirement on you to make sure you stay covered as you go along. Those pieces can be made to work, but the intricacies are very difficult, and we have to make sure that in the course of getting to the final outcome, we keep covering people and we get to a stable regime. But it is possible. And
you actually come from Germany, single payer system. You've grown up with that your entire life, so you've seen it work in another country. What do you think we can learn from Germany's system and take to the US?
That's an interesting conversation because Germany is not a single payer system. It's a mix of public and private partnerships, insurance companies, hospitals, doctors, and so on.
Yeah, rich people can pay a little bit more.
Everyone's covered. That's the important. That's the important thing. I don't come from a rich family, but I had private insurance actually because my father was a middle school teacher. Then you also be able to buy into a different insurance coverage. I think what we can learn from there is really the following. Compared to OECD countries, okay, US versus other rich countries in the world, Germany includes, we go to the doctor less, 4 times a year versus 6.5 times a year. We go to the hospital less, 125 discharges per 1,000 members versus 164 discharges in other countries, okay? There's less utilization of healthcare in the US, and yet somehow the system is twice as expensive. It's almost all in the unit costs. A bypass surgery in the US costs between $60,000 and $180,000, on average $78,000. A bypass surgery in the next most expensive OECD country, Switzerland, costs $34,000. In Australia costs $25,000, so Germany is even farther behind. It's all in those unit costs. Healthcare as a whole has to become a more competitive market, if you will, where we are all covered. You and I have to know what costs we inflict on the system, on us, by going to hospital A versus hospital B. Our doctors have to know. We have to all be smarter about essentially telling hospitals, you are charging too much. I want to get your cost in line with the performance you have. If you are doing this particular part in a better kind of way, you can charge up for that, so we're going to get you covered there. But if you are doing a run-of-the-mill procedure, you're charging through the roof just because you can, just because so much of healthcare is essentially cost plus, people charging a flat margin on top of a rising costs. We're never going to be able to fix the system, and we will keep talking about rising deductibles on this stage and the other stage for years to come until health care is a quarter to half of GDP, and then good night. Go to Pittsburgh and look at the cityscape. It used to be in the middle of Pittsburgh, this beautiful tower called the US Steel Tower. That used to be a tower built by a company that built stuff, made steel, right? Or did something with steel. It's now a building full of hospital administrators, not doctors, not people saving your life, but hospital administrators. And that's to me sort of like a good illustration of how expensive the system has come and how we have built a incredible cost-plus industry around healthcare that doesn't lead to better outcomes, has incredibly overrunning costs, and doesn't really serve anybody well because we don't even manage to make that system cover everybody in the US with good healthcare.
So your solution is cut out the middle guy, cut out the bloat, reduce the healthcare system to the basics.
Basic solution is let you guys vote with your feet, okay? buy Oscar, buy another insurance plan that you think gives you the right doctors for the right price, for the right premium, and hold doctors, hold hospitals accountable to delivering the value they deliver at the right price. And I think then in healthcare, a ton of more innovation will be unleashed. You saw the proliferation of urgent care clinics in New York City. That wasn't invented by hospitals, it was invented by an ER doctor on Long Island who thought, I should build a cheaper version of an emergency room that is a better experience at a lower price. Only in healthcare can you say without blushing, I'm going to build you a better product at a lower price because the rest of the system is so overblown.
Well, thank you so much. That's all the time we have. Thank you again for speaking with us.
Thank you.